everyone, I am Monica Guzman, a student nurse from Davao Doctors College, and for today's video, I will be demonstrating how to properly assess the eyes of a patient. But before we go through to our assessment, let me show you the materials needed for this assessment. Guzman, a student nurse, and for verification, may I ask what is your name?
My name is Ivy Ivo.
Okay, when is your birthday, ma'am?
November 22, 2001.
Okay, age?
20 years old.
Okay. So before anything else, may I ask what do you want me to call you?
Just call me Ivy, ma'am.
Okay. Today I will be doing an eye assessment, and so I am going to check if your eyes are in a good condition, and I will also check if there's any problem in the parts of your eyes, and also I'll be checking if you have any trouble of seeing. So I wanted you to inform that during our assessment, I will be asking you to stand up, to sit down, and to read. So everything that I have observed will be documented, and of course, rest assured that it will be confidential between me and the attending physician that I will be referring to you. Would that be okay?
It's okay, ma'am.
Okay, so before we start, what language do you want me to speak?
English and Tagalog.
Okay. Do you have any questions, clarification before we proceed?
No, ma'am.
Okay. I have already closed the windows and the doors so you will be more comfortable throughout our assessment. Okay, let me ask you some questions in regards to your health history. Would that be okay? Okay, can I ask, why are you seeking care? Do you experience a sudden loss of vision?
Yes, ma'am.
Okay, can you describe it?
It is blurred when I look into far, and especially when I look into my face and my cell phone for too long.
Okay. Is there any spots or even floaters?
I know, ma'am.
Okay. Have you any trouble seeing at night?
Yes, ma'am.
Okay. Have you experienced double vision?
Yes, ma'am.
Okay. What about pain in the eyes?
Yes, of course, ma'am.
Okay. Redness or swelling?
Redness?
Okay. How about tearing the eye?
Yes, ma'am.
Okay. So for the past history, do you experience any previous problem in your eyes?
No.
Okay. What about excessive watering?
Excessive watering?
Okay. Did you go to the hospital for a checkup with that?
No, it is my first time, ma'am.
Okay. Well, proceed to your family history. Is there any in your family experiencing loss of vision?
No, ma'am.
Okay, that's great. What about to your lifestyle or health practices? Do you have any exposure in the extreme chemicals, heat, dust, or smokes?
No.
Okay. Are you wearing eyeglasses or contact lenses?
No.
Okay. Okay, that's all for the questions. I'll be proceeding to our assessment of your eyes and visual acuity. Would that be okay?
It's okay, ma'am.
Okay. So, okay, in this assessment, I wanted you to use this white cardboard. So, you have to cover your right eye, and your left eye would be using to read the Snellen chart. And after that, you have to cover your left eye, and you have to read the Snellen chart using your right eye. So, after that, you have to read the Snellen chart using your both eye uncovered. Would that be okay?
Okay, ma'am.
Okay, you can now start.
So I'm using my
E F P T O Z L P E D I E C F D E D E C Z F F E L O T Z D D E E ZOTSC. EFP T-O-Z, L-P-E-D, P-E-C-F-D, I-D-E-C-Z-P, F-E-L-O-P-Z-D, D-E-S-Z-T-O-B-Z, E-F-P-T-O-Z-L-P-E-D, P-E-C-F-D, I-D-E-C-Z-P, F-E-J-O-F-Z-D, D-E-I-Z-O-T-S-Z.
Okay, well done, Ivy. So right now I'm gonna proceed to the vision test. So what I want you to do is that you have to tell me how many fingers I'm raising, okay?
It's okay, ma'am.
Let's start.
4, 5, 3, 2.
Okay, that's great. So right now we're gonna proceed to our hand movement. So you have to tell me which direction I'm pointing out, okay? Start.
Left side, top, right side, center, down.
Okay, that's great. So right now, you have to tell me if you could see the light. Okay, did you see the light?
Yes, ma'am, in the right side,
Okay,
above in my head, left side, down.
okay, that's great. So now I'll be checking your eyes. If it is aligned. Okay, your eyes is well aligned, so your eyebrow is well distributed. So can you raise your eyebrow? Down. Okay, I observe that your eyelashes are quiet, is evenly distributed. So can you close your eyes for me, ma'am? To check if there's any discoloration or present lesions. Okay, you can now open your eyes. There's no lesions and any discolorations. Now I'm gonna check your lacrimal and lacrimal sac. Okay, there I observe that there is no swelling or present of edema and lesions, which is good. So, can you straight look at me, ma'am? Okay, as I check your pupils, there's no opacity present. Okay, that's great. Okay, at this juncture of our assessment, can you say please yes if you see my hands entering your visual fields, okay?
Yes. 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 Yes.
Okay, so I'll be doing this again using your right eye and left eye. Can you say yes again if you see my hands entering your visual fields?
Yes. Yes. Yes.
Okay, to your right.
Yes. Yes. Yes.
Okay, that's great. Okay, I already turned off the light to check your pupillary reaction. Okay, can you straight look at me and look into the distance? Okay. Look into the distance, ma'am. Okay, good. Okay, right now, I'm gonna check your pupil reaction to accommodation. So what I will need you to do is to look at in my pen light, and you have to look at in the back and the wall of my back, at my back. Okay, when I say look at in my pen light, you have to look in my pen light. So when I say that you have to look into the back, the wall at my back, you have to look at it. Okay,
Okay, ma'am.
look at in the pen light, at the back, pen light, at the back, pen light at the back. Okay, great. So right now I'm gonna do the Bird test, and this with pen light, I'm gonna turn in my pen light and just shine in your eyes. You have to do is to look straight. Okay? Just look straight now. Okay, that's great. So now I'm doing the cardinal gaze. I wanted you to follow the light with no moving of your neck and just your eyes. Okay, without moving of your head and neck, just your eyes. Okay, focus. Okay, great. Well done, Ivy. So now just follow the pen for the and checking of the eye convergence. Okay. Okay, that's great. So our assessment is done properly. Okay, so for this assessment, I observed that for your Snellen chart result, you have 20/40. So it is considered abnormal. So I did the selection test, and I documented it normal because you can see anything. So for the cardinal gaze test, you did the 6th position. So which is normal. Your both eyes are coordinated, move in unison with parallel alignment. So there is no nystagmus and strabismus. Okay, that's great. So for when I assess your eyebrow, eyelid, and eyelashes, the hair is evenly distributed. The skin is intact. Okay, the eyebrows symmetrically aligned, or and equal movement, which is normal. Okay. Upon checking your cornea, it is shiny and smooth and transparent. Details in the iris are visible. Okay. For your pupillary reaction, it is illuminated pupil constrict, and response is brisk, which is normal. So for the accommodation and convergence, the pupil constrict when looking at the near object, and pupils dilate when looking at the far object. Okay, pupils converge when near object is formed toward your nose, which is normal. So when performing the Hertzberg test, light falls symmetrically, so which is normal. So okay, I am done with the assessment. So I'm gonna handle this documentation to the attending physician that I will be referring to you. So what I can advise you is that since your result of your Snellen chart is 20/40, I advise you to minimize using the full brightness of your phone, and minimize using your phone, and avoid stressing your eyes. I advise you to take vitamins and healthy foods that is good to your eyes. Okay? So, and lastly, take time to rest your eyes from extreme heat, chemicals, or any dust. Okay, so that's all. So before we end, do you have any questions, clarifications on this assessment?
No, ma'am.
Okay, that's great. Thank you so much for your cooperations, and that's all for today.
Thank you so much, ma'am, and thank you also for the advices.
Okay.